my name is Kambiz Hanani, and today we're going to talk about the structures of the neck, which is the anatomy of the cervical spine. Here we have an x-ray of the neck, and we're going to compare that to what we can see here, which is a three-dimensional model of the neck. We can see the vertebral bodies here, the disc spaces in between, the holes through which the nerves come through, and here's a side view. Here's the second, third, fourth, fifth, sixth, and seventh vertebral bodies, which can be compared to the cervical x-ray, again showing us the vertebral bodies, the disc spaces in between the vertebral bodies, the facet joints, and here is the spinous processes, which is the elements we feel if we were to touch the back of our necks. And as we rotate this around, we can again see the lamina and the spinous processes, which are protecting the spinal cord. On the other side, we again see the facets, the foramina through which the nerves come out, and again the vertebral bodies and the discs. Here again we have a normal x-ray of the neck. On the other hand, here's an x-ray where we see the normal discs, and here is a collapse arthritic disc. So between the fifth and the sixth vertebrae, we can see the discs very collapsed compared to a normal disc, and this can cause a lot of problems with neck pain as well as arm pain. X-rays are great for looking at bones, but in the neck it's a lot more important for us to actually see the nerves, and that's where MRIs come in. Here's the second, third, fourth, fifth, sixth, and seventh vertebrae, the normal discs in between. We can actually see the spinal cord as it comes down here, and then the fluid in front and back of the spinal cord, which protects the spinal cord. On the other hand, here's an abnormal MRI where we see the fluid coming down, and as we get closer to the C5-6 level, we can see a disc herniation coming over and really obliterating that fluid and pushing on the spinal cord. Here's another example of a big disc herniation here. Again, we can see the fluid looking normal, a little bit of a herniation there, but as we come down, we got a large disc herniation putting pressure on that spinal cord. Another way to look at these MRIs is to get a cut from up to down, right, and from the side. Here's the cut from the axial view, which is the cut from this up to down view, and we can actually see in this case where the cord looks good here with the fluid all around it, and as we come down to the area where the big disc herniation is, we can see a big disc herniation coming down and really pushing on that spinal cord. So in summary, X-rays show us real nice anatomy of the bone, how the disc has already collapsed here. The disc looks okay there, but they really don't show us much about the nerves. The MRI shows us the discs, shows us the bone, and then really shows us nicely how the spinal cord looks good in this area with fluid in front and back of it, and then it just goes through this jagged area and is under a lot of pressure. Here's an example of an X-ray after somebody has had surgery. In this case, we went in and we took out 3 of the discs, put 3 pieces of bone in its place, and put a nice little plate in front to protect this area that we've done the surgery on. And here's looking at it from the front, with the head being up here and the chest here, and here's the neck. We already saw a nicely placed plate and screws in that last view. Here's an example of somebody who had their neck surgery done at an outside clinic, came to us with significantly worsening pain, and we could see part of the reason was the plate was coming off, with the screws coming off, some screws not placed in proper positions, and so forth. So sometimes surgery can actually make you worse, and in which we can see here where the plate was not put in properly. Another way that surgery can be done is from the back side. So instead of going from the front and putting the plate in the front, we can put some screws, rods, and some additional wires to try to hold things in a good position that we can see here. Here are the screws, here's the rod, and here are the wires. So in summary, we've learned about the anatomy of the neck, with the different bony elements. We have looked at the soft tissue elements, including the spinal cord and the disc herniations. We have seen what x-rays look like after we have had surgery, both from the front and in this case from the back. That actually concludes our discussion of the anatomy of the cervical spine. Thank you very much for joining us.